Good morning and welcome to the first session of the day for the Global Scaling Challenge. This morning I'd like to welcome THAPER Institute from India. Siddaq is our point of contact here. They are about to begin their presentation. Again, I will remind the judges to please put all of their questions in the Q&A for the session so that I can read them out when it's time for the question and answer session. If the students are ready to begin, please start and I will start your clock.
All right. Good morning, ladies and gentlemen. Today we are going to propose the strategic choices to a very special media technology company, BennuBio. Although BennuBio believes, their tagline says that they provide sound science delivered, but we feel that they have the power to powering passion for particles. So this is our proposed tagline for them. Talking about the flow cytometry market, the world was estimated, and this was from a Grandview Research Online. The world estimation was of 2020, 6.3 billion, with compound growth rate at 8.9%, and North America being the dominating market for flow cytometry technology, with the share of around 39.1% of the total world market. What are projected market size for 2025? The world projected market sizes, and under the pharmaceutical, we project 8.5 billion, diagnostics 1.5 billion, 2 billion for general R&D, research and development, and we also propose a new segment which is food and beverage with 2 billion for the biological analysis. So about 13.5 billion we project for the year 2025. Interestingly, new found technologies, the mRNA technologies, will definitely boost this market. We can use flow cytometry as an analytical tool to make whatever protein we can make. Through this PPT, I would also like to introduce Ms. Caitlin Carrico, who is a biochemist, and she had a major role in developing the mRNA vaccines. So considering the 5% of the total projected market size, we believe we are projecting the revenue of 0.7 billion, considering that there will be increase in the lifestyle diseases, the demand for rapid and accurate techniques for disease validation, and investment in R&D. We propose that there is a product available, but we can also expand on developing an ecosystem where we could provide our services and the product. So this is our projected revenue stream. We already have a product, we will provide them services, and we'll develop an ecosystem. Currently, we are already selling our box by the name of Velocite. What we also propose is that we can go to install and operate model. Talking about install and operate model, what the user benefits are that they don't have to put upfront cost. They will have access to the advanced flow cytometry technology, and our benefits would be that it's a recurring revenue. We can form the revenue in form of subscriptions or even leasing. And it's an opportunity to capture a larger market. We can, here the focus is on the small traders who would want to use our technology. So this install and maintain model is beneficial for them as well. This is a very interesting, proposal that we have, that we can make a collaboration ecosystem. It's a website plus. And it's a very important strategic choice proposed to you, where different partners, be it researcher, equipment manufacturers, chemical manufacturers, students, they all can come at one platform and collaborate, co-create, we can give them consulting services, we can give them product selling our product, and on lease also. So it will be a ecosystem which can be on different operating systems. We can have it in the form of app, we can have it in the form of a website. We can also extend our website in this. Of course, we can never neglect that forming the right team is important. I know it's a challenge for a company like this to attract trained employees, but people with right skills, right passion, persistence, and commitment. So if we are able to find people with these attitude skills, then I feel that we are on the track. So next 5 years, we are projecting our fundings for 2.5 million would be needed for building the platform, the service, the development of it. For overall marketing, we project 4.4 million. For operation and services, we are projecting 2.5. So the total projected funding needed would be around 9 million. Of course, there's no substitute for the social media, but here what we want to focus is that our influencers should be universities and medical school researchers. There should be a presence on the research papers, because now our customers are really smart. They know that if you are an influencer, you are a paid influencer. But when it comes to research papers, it has no agenda behind it. And we all believe that our influencers we should focus on universities and medical school researchers. It's very important to build a community around the product, because our competitors are also strong, but we have the capability of providing high quality service to our customers, be it small players, be it large players. Let us just focus on that and be proactive. Finally, right now, presently, the flow cytometry technology, we are using it as a product, and we are about to sell the boxes in using the VeloCyte product. Our opportunity is to use this product and also provide services in form of a platform and with the install and operate model. Our future could be connecting all the stakeholders, because we have great potential to serve the world. Thank you and have a nice day.
Thank you so much, Nivedita. We are actually a little bit early coming out of that, so we'll have a little bit of extra time. If the judges will please ask their questions, we have about 12 and a half minutes for Q&A. Daniela asks, how did you estimate your funding need? Where will the funding be obtained?
Okay, 1 second. I would like to go through my PPT. Okay. So what we have tried is, we have tried to take very conservative figures, and depending on our market size, we thought that this funding is the minimum of the projected market size. So that's how we thought that building our platform is one important, where we would need funding, marketing and operations. So this is the bare minimum, where it's just an estimate, it's just an assumption, but of course based on some projections and figures.
I would just like to add that from where would the funding be obtained? It's we know that the company already has seed funding and they already have a couple of rounds of funding. However, if they have a compelling value proposition that we have just proposed, they can definitely get a lot of funding if they are able to convince the venture capitalists, and we don't have a doubt that they'll be able to do that.
Thank you. Other than social media and influencers, what specific marketing do you propose and how have you estimated those costs?
Well, just like I proposed that other than social media, I really feel that our influencers should be university and medical school researchers, because when it comes to social media, our current generation is very smart to understand that it's a paid promotion. Therefore, we propose that university and medical school researchers don't have an agenda. They are really realistic and their analysis are very serious ones. So I really feel our influencers should be real people, people around us, not having any agenda. That's what our influencers should be.
I would like to add here, so as Nivedita suggested that we would like to have medical researchers. The idea is we'll partner with universities and let them use the product to basically come see how effective it is in their research papers, and this will help us reach a wider crowd because they'll know that this product is being used. And yes.
Thank you. What do you see as the largest challenge in implementing this plan?
I think the largest challenge is that some of our competitors are also doing the same thing, but due to the speed of our product, we are already at an edge. And if we really do it and add something more, like we mentioned, Website Plus, which is just more than a website, it's a complete ecosystem. So I think we'll overcome this challenge shortly.
Thank you.
And to add with it, we would also, a little challenge would be having trained professionals. It's a very new market. But it's a very dominating market as well. So I feel that the only challenge we will have is to identify very passionate, skilled, personals. Yeah.
Thank you. What makes this a compelling investment in comparison to peers?
I believe that the peers, the competitors, they do not have a concept that we have proposed of Website Plus, wherein we are not only proposing collaborative or co-creation of the products of ideas, we are also suggesting advisory services that can be provided, including product selling of Velocite and leasing or the maintain and install model that we have suggested. So I don't think, I believe that the peers do not have such a platform where there can be collaborative effort of researchers, students, and anyone who is interested in this area. Yeah.
Also, I would like to add that through this proposal, we are developing a co-creating community. All this will create a stickness, for example, that we have a diagnostic, if it comes to diagnostics, they want to test a protocol and they need some advisory on how to test a protocol. So they are co-creating, so it's a very new market to explore. It's a very new idea to explore.
Thank you. If pharmaceuticals is the biggest target, would you reach out to them directly?
Yes, I believe reaching out to them directly through the app is through the platform that we have, the ecosystem that we are proposing. This could be one of the tools, and yes, pharmaceuticals will be our biggest target. Anybody who wants to add on that?
Yes, so pharmaceutical would be, as it's the biggest industry for clinical trials, we'll have to first target them. We're also proposing that we'd reach out to the food industry for microbiological testing. That would be like the second stage because that's also where we would like to explore.
Oh yes, I'm so sorry. I just missed out that how would you, would we reach them directly? We can also, we should organize conferences. We should organize research conferences. Invite pharma researchers to present papers. I think that these are really great, solutions to reach out to the pharmaceutical target segment.
Thank you. We still have about 5 minutes remaining in this session, so judges, please continue to ask your questions. How do you estimate your revenues for 2025? Which data was your estimate based on?
So we went through the Grandview research report, the funding report, and we saw what is the market size where flow cytometry is applied. We not only saw it in pharmaceuticals, diagnostics, food and beverages, and there's also water contamination. So through that report, we were able to see what are the projected revenues, what is the market size, and through that, we were able to estimate the revenues that the projected revenues, estimated revenues that the company can, earn till the year 2025 from now on. So that was the basis of our projected revenue.
Also, it is very difficult to estimate the exact, the estimate, the figure. So we have only tried to make a rough estimate, and our estimates are very conservative.
Thank you. Did you do analysis on pricing of this product versus competitor products?
We did not do the pricing on the traditional product, the Velocite that, because we saw that the company has already decided on $100,000. But what we suggested is, with that, what all we can focus. We can focus on the services. We can focus on the platform, the ecosystem. So our focus was more on that. So we did not estimate the cost.
So just to add on to that, so we are not proposing another physical product other than Velocite. What we are doing is we are suggesting how can you increase the market size. Right now, it's a one-time sell that you do with Velocite. However, with the maintain and the install and maintain model, what you can do is you can reach out to those economically constrained researchers and other market players, small players who cannot afford this Velocite, which is $100,000, who cannot afford them directly. Yes, through the install and maintain model, they can actually have access to this technology. They can use it, and they can pay a monthly subscription. Through that, the company also gets a recurring revenue. and is also able to reach a larger market.
Yes.
Otherwise, I don't think the small players can afford $100,000 who want to actually use this technology. So we are not only helping the users, but the company is also benefiting from this model that we suggest. Not only this, we also suggest a website plus, which the peers are not having. So that is an addition to what we are suggesting. So we are not suggesting any physical product as such. We are suggesting it in the services aspect. Thank you.
It's an extension to the product, basically.
Thank you. We have about 45 seconds left. Are there any other questions? Okay, with about 15 seconds remaining, I'd like to thank the team for a wonderful presentation. I'd like to thank the judges for being engaged and asking excellent questions. We're going to prepare for the next session. Thank you so much for joining us from India.
Thank you so much. Thank you for having us. Thank you.
Thank you.
Thank you so much.
Okay, take care. Go ahead. And once again, I'll go through the rules. You will have 20 minutes in this session, 10 minutes to present. At 2 minutes, I will go into the Q&A session Q&A on the right-hand side and tell you that there is a 2 minutes remaining. At 1 minute, I will do the same and I will turn on my camera. So when you see me, you have 1 minute remaining. Any time that you go over that 10 minutes will be deducted from the question and answer session. Total session time is 20 minutes.
So a very warm greetings to all the judges and all the viewers that are watching us. We team 4-1 from FORE School of Management India, and we are here to discuss the firm BennuBio. Next slide, Prikshit.
Yeah.
Just to give you a very brief introduction about what BennuBio is, it is a flow cytometry startup, and it is a very emerging technology company which is delivering unique cell analysis systems, and it is accommodating large cellular spheroids and a single analysis which will be at a rate of 10 to 10x flow volume and event rates. And the product is Velocite, which is a large particle flow cytometry. It is fast, it is flexible, and it is economical. It is fast in terms as in when a normal product takes around 1 cell per minute, it is in an hourglass shape. This takes at least 100 times faster, and it is more than the typical flow cytometer. It is flexible. It analyzes sample volumes it goes from microliters to that the maximum it can go to is millimeters, which returns undiluted intact sample and which helps preserve what the cell is. Next slide. So starting right up with the scale process, we are dividing our scaling process into 4 basic groups. First is we are analyzing, we are doing a market research to understand this sector. Secondly is we are analyzing what the position of the company is at the moment. Third, we're finding what the target audience is and how we can position it there. And lastly, the importance of networking and partnerships. So what are the basic challenges that we need to address? So based on our research, we came up with 3 main challenges. The first is how do we make a market presence and instrument sales which will act as an initial driver? We need to find what will make this company go forward. The second is we need to find the right target audience and we need to apply strategies in that aspect. And third is we need to find awareness about the product. And there should be more and more awareness so that people and companies get to know about this and incorporate this, and government agencies as well. Next slide. So we read that there were a lot of resources already available by this company, that BennuBio has raised around 2 million and funding and a 5 million funding in B funding. In addition, it has also received a 2-year, 2 million grant to expand the capabilities. So these are the resources that are already available, and we're trying to use and manifest them forward. Next.
Yeah, thanks, Akshita. Now I will be explaining about the primary research that we have done to understand the target audience we are targeting and understand the basic behavior of the all the target audience or the potential customers we are targeting. So we did the research type is survey and telephonic conversation. We had with our potential customers. We also had some in-depth interviews with private clinics, labs, and research institutions. So basically, we got to survey about the 25 respondents participated in a survey which includes private and government hospitals, private clinics, labs, and research institutions. So basically, we got insights that private clinics and labs who does not operate on a much large scale are skeptical about a huge investment of $100,000 as it will take years to get ROI from the same. So they are preferring that we will go with this product, but the cost of this product is too much high for us to invest in this product because it will take decades to get them ROI for the same. So now coming to the private hospitals, they are ready to make the investment provided proper training and after sales services are provided to them because they are skeptical about the functioning of this product and the after sales services that we don't have the trained staff to get this product working to know they need to know the functioning of the product, and they also dubious about the after sales services that they will get after investing in this product. One more thing, private hospitals are why they are readily available agreeing to buy this product or show interest in this product. They say that we will make a huge revenue from this product and it will increase our customer base, and also it will decrease the time and man labor we are putting in the research and all the tests we are doing in the hospitals area. So government hospitals and research institutions still thinks it will just increase, this product will just increase the cost, and traditional methods are very effective for them. Now coming to the scale up process, we the company should do the quality program and in which tie-ups with the private and government hospitals, doctors, labs to grab their attention and provide them with the customer base by running their health free checkup campaigns. Let me put up this with an example. For example, I am a company and hospitals are my potential customers. So what I will be doing, I'll be partnering up with the hospitals and the doctors connect and do the free health campaigns and checkups in the nearby areas or local areas where I'm geographic areas where I'm targeting my customer base or hospitals. It will basically give me the two benefits. The doctors and hospitals, we show the potential of the products and benefits of the products that what our product is offering, and in addition to that, hospitals will see that by this through this campaigns and through this health surveys or campaigns we are doing in the market, they are getting the customer data that is more important for the hospitals to further leverage upon the data and earn the revenue from them. So also we can do is for the labs and private doctors or clinics, organize events and conferences for the private doctors and organize incentive or recognition events. The company can actually do organize an event or program in which we will also uh, just do tell about our products or what we are offering to them and what they can offer and how they can earn the revenue. Rather then we can show them how the hospitals and doctors can earn the further revenue from this product. We will also recognize them for the well-being they are doing to the community, or they are doing their noble work in this healthcare sector. So they will feel in, kind of they will feel superior that their work is being rewarded, and at the same time we are targeting our product to them. Also, the company can do attend national and international conferences, workshops, events, and seminars on the healthcare related or pharmaceutical related issues and topics, which will again grab the attention. We can, we can have the potential investors in it, and we can have the attention of the other partners firm, other global firms that are doing the same kind of work, or we can grab the attention of technological aspects, scientists and great scientists and technical people. We can grab their attention, participate in safety and health expo, in which the company can display its product, tell the benefits about this product, and from there on we also can find the potential customers. And because lots of hospitals and recognized doctors do attend these expos and conferences. So obviously I told the benefits already, but why we will be doing this? Hospitals, labs and clinics will be getting their customer database. I think the most important thing for them is the database that they can work on in the future, and also they will be getting the product and by which they can further earn the revenue, awareness about the product and benefits of the product same. So benefits in the again, the main benefits will be creating from this is getting from these is they will create demand and awareness of the product in healthcare industry, pharmaceutical industry, will attract potential investors and partners for the product. Now going forward.
Yeah, so when we're talking about customer development, we need to find our target audience. So our ideal customer range is the research labs, private government hospitals, and medical-based institutions, where colleges that can use this sort to understand what is happening. And what are their needs? They want a faster, flexible, and economic ways of cells analysis systems. What channels? We can use biotechnology pals, we can use safety and health expos, we can use word of mouth marketing and conferences. What methods can be used to maintain customer growth? We need to focus on positioning this. We need to add to the existing product and constantly innovate. Next picture.
Yeah.
Networking and partners also play an important role here. Contract research organizations partnering with something like that is very important. And this can ensure that the patient experiences and needs are prioritized and recorded, and that the cell efficiency and the way this system works is very effective. Next slide picture. Finally, what are the benefits that will happen from the scale-up process? It will be profitable if we partner, and there'll be a source of employment in terms of training and all the back-end processes of the system. We'll be optimizing our resources that we explained in the first slide, and there'll be new partnerships and global growth. In global benefits, this pandemic, because it is helping in the vaccine development. It has community enrichment, it helps the community, and it also is creating new sources of environment, which is also a global benefit, and it is innovative, economical, and efficient. With this, we conclude our presentation, and we're open for questions. Thank you so much.
Thank you very much. I would also like to let the team know that we are congratulating them for being the People's Choice Award for Asia yesterday for their presentation. Very well done. Thank you so much for participating in our first annual Global Scaling Challenge, and good job here today. Will the judges please ask their questions? Did you do research on the TAM? How big is the addressable market?
Yeah, we did our primary research on the TAM itself. We got to know we have we are doing this on the sampling basis. We just because of the time constraint and the things, we just put up a we did it in a city level, or you can say we did it on a state level. Just we figure out all the hospitals, or make the list of the target audience we can grab the attention of, or made the list of all the target or potential customers we can target. We made the list of all the hospitals, you can say all the research institutions that we can target, private or clinic, private clinics and labs. So yeah, we did the research on the same, and we came up. Yeah.
Just adding on to what Prikshit said, we did a very basic research on just trying to understand the ideology that people have related to this product. So that's what we were trying to figure out, and that's how we move forward.
Thank you. Can you describe the market opportunity in dollar figure?
We have not worked on that sector. Prikshit, can you describe that a little? If we have a very basic estimate, I remember.
Yeah, we did not, we did not do the exact research on the dollars that you are asking to us. But yeah, we just did our, put up the numbers that what can, by investing, we are not doing B2C. We are again not going B2C. We have the, mindset of going to B2B, because again, it's when we are going to B2C, it will cost a huge, it will put a pressure on our financials, and it will cut down our revenues. So we are basically targeting B2B segment, and in it we have not done exactly the cost analysis of this. But again, we are not saying that we have to start up with the aggressive marketing. We just have to do the right partnership and tie-ups with the private and public institutions, and run these campaigns and conferences. This will move around the things for the same.
Thank you. Have you done cost analysis of Velocit versus competitor products?
We did read about some of the competitive products, and we also understood that this was something that was extremely innovative in the sector, and the other biotechnological companies were not offering the exact same thing. And Prikshit, do you want to add?
Yeah, we did the analysis on the same. We did the analysis on the what competitors are providing to the industry, and what our company is providing to the industry, and at what price we are providing, and what price our competitors are providing. First of all, this is one of the most innovative product that health sector has got up to now in this field itself. So exactly, competitors are not providing this same product, but competitors are, have launched already this kind of product which do up to certain extent the same work, and they are providing it in very less cost in India itself. If we take the example of Indian healthcare sector, yeah, the Indian pharmaceutical sectors and the companies are providing these type of products in the very low cost, because of the innovation and technology. They are, because of the competition, they are providing it in very low cost. So when we did our primary research, the main thing we got to know that other competitors are providing this same kind of product in a very low cost, and the companies charging us $100,000 for the same thing. So we will not able to invest, because there are a lot of private clinics and small scale clinics and labs are operating in India. So they are not able to invest a large amount of finances in it or money in it. So because of this thing, they are skeptical about the ROI they will be getting.
Thank you. What funding and staff changes will be needed to implement this plan?
Funding, in terms of funding, if we talk about, we were trying to utilize the sources that were already available, and we feel we need to partner and network a lot. So this company, we read about something called Contract Research Organizations, which is a company that provides towards pharmaceutical, biotechnology, and medical device industries on a contractual basis, and this is basically in the form of research. So they outsource that and provide contractual basis in that. So that is how we are going to move forward with funding.
Sorry. Adding on to what Akshita said, I just want to say we are not, saying that company should launch on the new product or do innovation in these product immediately, as it will require a huge amount of funding for the company and a huge amount of resources to put in the for the company. We are just saying to go on easy with the funding thing, and by simultaneously while partnering up with this. Hospitals and public institutions, they will provide us, they will, they are pretty much interested in product. We just have to tell them benefits of the product. Actually, we just have to tell that what the product is all about. They will be investing on product, and from the revenue we are getting from this, we will further do the innovations and launch the new product, or there is no separate. We are not saying that we need funding in huge amount. We will be getting the funding from the basic initial steps. We are telling that the company should do these conferences, do attend the expo seminar, expo events, do attend the seminars, and do the marketing thing. We are just all saying this. Hope this answers your question.
Thank you. Which costs do you expect for the free health checkup campaigns?
The free health checkup campaigns that we mentioned, basically it is more of a research
Let me
product.
take this question, Akshita. Sorry to interrupt you. Sorry to interrupt you. Yeah, we are saying that the company should do free health checkups with tie-ups with the hospitals. Actually, we did the in-depth interviews with the owners of the hospitals and the doctors available in the hospitals, and we got the insight that they are ready and they have done in the past these various health checkups with other pharmaceutical companies or other private sector companies which are delivering them these products. The benefit the hospitals get from these health campaigns are actually going on the cost thing that you are asking us. Hospitals will completely fund our this health campaign. We actually talk to them and they are ready to fund our complete health campaign. It will not cost, especially in India, it will not cost a fortune. It will only cost just basic things, and hospitals are ready. Hospital and private clinics even are ready to fund, because they are getting the huge amount of data that they can work on the future and they can generate, because data in our times is a huge thing for anyone, and they can work upon and they can further generate the revenues from them. So this is the thing.
Thank you. We have about a minute and a half remaining in this session. Speaking of cost, you mentioned profitability in your presentation. Do you have a target profit margin you plan to achieve?
The company has a profit margin that it wants to achieve by 2021, and this is our first main goal as of now. And profitability, we believe, when we partner, and our funding will be mostly from outside sources. So we will obviously, by selling the products, the whole market will come to us and will be that is how we'll profit in terms of the company, and we don't have to put in a lot of money in terms of marketing and in terms of expanding the growth. That will be done from the partners or from the CROs that we mentioned. Prikshit.
Just want to add one thing in it, that we are not, we have not yet defined the profit margin for the same, but by showing that we are doing by increase the sales of the company. I guess if the profit margin decreases and company have to invest something for doing these health campaigns and organizing the events and conferences by themselves, if company got allocate the resources or funds in that, it will increase the sales of the company. The sales figure will increase, which will ultimately increase the profit of the company. If not the revenue size for the single product, it will overall increase the company profit by
Okay.
targeting. Yeah.
I would like to thank you both. We've come to the end of the session, but please remain on for a moment. If Heidi and Yorgos would like to join us, please.
Yeah, sure. Hello, good evening.
Hello, how are you guys?
We're fine. How are you?
We are fine.
Good. We just wanted to get on again and congratulate you guys for yesterday. You guys are doing so well, and we're so grateful that you are here with us.
Thank you so much. We're
Thank
very
you so
honored
much.
to be a part of this.
Yes, congratulations for winning the People's Choice Asia Award. We hope that this is motivation, additional motivation for you to continue with what looks like maybe great careers for you.
Thank you so much. We're very
Thank
honored and very grateful. Thank you.
Thanks a lot.
Well done, both of you.
Thank you.
Okay. I would like to welcome the second team from the Foundation for Organization for Research and Education from India, the FORE Group 2. That will be what you will mark on your scorecards, judges. Again, I'd like to welcome this team back. Excellent job yesterday. Thank you for participating in our program. My name is Linda Stewart, and I am your moderator for today. You will have 20 minutes, 10 minutes for the presentation. At 2 minutes, I will let you know in the Q&A when you have a 2 minutes remaining in your presentation. At 1 minute, I will do the same, and I will turn on my camera. When you see me go live, that means you have 1 minute remaining. Any time that you go over will be deducted from the Q&A session, and for every minute you're over, you will lose a point. So I want everybody to be aware of the rules before we get started. Whenever you're ready to start, please begin.
Hello everyone. A very warm good morning to one and all present here to the UNM Global Scaling Challenge on
Anuksha, are you there?
First of all, audible. Hello.
Yeah, Anushka, you're picking up on me. Hello, can you hear me?
I can hear you, but I don't know if my voice is breaking.
Yeah, you're breaking up. I don't know where your microphone is, but it sounds like something's rubbing against your mic.
Oh. Is it okay now?
Yes, that's much better. Thank you. And is everybody here?
So first of all, we are giving a brief introduction. Laboratory method used to detect, identify, and count. This method can also identify particular components within cells. This characteristics and or markers called antigens on the cell surface or within. Next slide. Ayushi, I'm not able to see the slide. Which slide?
The slide is not moving forward.
Yeah.
Okay, I see it now.
BennuBio, has created which is the flow cytometer, which introduction I just gave, and which can analyze which is near perfect starting point to create a high throughput screening models. This is the company is an emerging technology company. Systems. It was founded in 2018 and it is based in Albert. Ayushi, I'm not able to see the slide.
We're having trouble with the slide moving forward. Okay.
Yeah.
Can you see it now?
Yeah.
I'm pausing your time at a moment. Are we having problems with the slide presentation?
Actually, I'm not able to hear Anuksha. That's why.
Okay, I've paused your time. Anuksha, can you please leave the session and come back in, and maybe that will help you.
Okay.
I'll do one thing. I'll leave the session and I again also join. Is it okay?
Okay, she's back. Can you hear me, Anuksha? Okay.
Yeah, now I can hear you.
Hello?
Now I can hear you.
Okay, yes, we can hear you. We're going to go back.
Yeah, now I can hear you.
Yeah.
And we're still having a little bit of problem with your microphone, Anuksha.
Now, I don't know if others can hear me or not.
Yes.
Now I can hear you. Yeah.
Okay.
Okay.
Okay, we're ready to proceed.
Yes. Okay. So coming on to scaling up this business, milestones or the tasks which you will be accomplishing. Second thing is research and related with research. You need to focus on research and development. You need to collaborate with research institutions like Cancer Research Institute, in the financials, the cost, the budget of the project in which you are under which country. Then you need to find investors for your funding so that it is strong. Marketing and advertising plan for promotion of the product. You need to acquire resources so that which are efficient in doing all the tasks and on the tasks on schedule, so that you are able to get the so demonstrated to various clients. You need to demonstrate in research labs as well. You need to set up production facilities. You need to analyze the government facilities, in which country, which government facilities favor you, which not, policies, the restrictions, the legal bindings which we have. Then you need to train and recruit employees effectively so that they perform well and according to your expectations. You need to have demo for users so that they are friendly with that instrument. You need to customize the model based on client requirements so that they are happy and satisfied. Of course, it is improved efficiency, since if you have an efficient and a trained workforce, there would be much better efficiency. Accuracy of test results. Then since there are large samples, so no dilution of samples is required. Then simultaneous multiple sampling, which would make the process fast. And then you will be establishing a competitive advantage, since you are the first in your idea and you are establishing it for the first time. So that would help you to gain a competitive advantage over your competitors. Next slide. Now, there are many difficulties since adoption of new technology in labs is very hard. Then there is a challenge of setting up cost, which is too expensive in the conception phase. High amount of technical expertise is required, good technical know-how. Time-consuming research is involved, and it may take very much time to arrive at conclusions, and then also they might not be clear. The geographic flexibility in every place, you can't set up the labs in all these things, and there are of course challenges due to culture differences and all. You have to face challenges in training the staff and the workforce. Next slide. Then setting up plant and R&D labs in every country is hard, since technical assistance and demos required. Import duty will be applicable, which would of course increase the price of the product, and there would be a delay in shipment. So, and other problems are that there is difficulty in resources, acquiring resources, because in every country there is different things. So you can't, every research lab, you can't acquire all the resources. It's not possible that it is not, it's not for sure that you will get all the resources at a single go. And then you have to, efficient management, you have to manage all the skilled people together. So next slide. Now coming on to the important part, solutions to difficulties of scaling up. First of all, you need to have a customized instrument testing facility as per the client requirements. Then you need to have instructions on the card how to use the product in every language. Since everyone is comfortable in their native language, they will be understanding it in native language better. Then you need to have promoting products in collaboration with the personality the people associate them with. If they feel comfortable in that and are likely to follow what the personality recommends. Then coming on to meeting guidelines and certifications of authenticity and efficiency of instrument, that is very important. Since if you met the standards, the standards set by the authenticity, you prove that your product is authentic, your instrument is working well, it is according to the standard norms, people are, you automatically build trust in customers. You have quality service, you have by efficient and trained staff, we have already think, and we have to, of course, make it a user-friendly instrument. Next slide. So that's all from our side, and this group like to extend a heartfelt thanks to all the team for giving us this amazing opportunity. For it was a great time to explore and learn. Thank you all.
I would like to thank the team. I think you've done a wonderful job. I hope this inspires you to continue with the work that you do. This has been a very nice presentation. You are out of your session actually a couple minutes early, so that gives us a little bit more time for Q&A. Judges, can you please ask your questions? Customer segment should take priority and
So I would say that the customer segment that we should take the priority at the first would be research laboratories, as it would be the first one that would be using the product to check if it's feasible, it's efficient enough, and what the company is trying to focus, whether it meets the standards. So they'll do testing, they'll do a match with what they already have the equipment with. If they find any improvements, then only they can go ahead. So first would be the research laboratory, I would say. Like it can be tie-ups with Cancer Research Institute or any other research institutes. That way.
thank you. Could you elaborate on the targeted market?
In case of the targeted market, actually focus on the laboratories where their testing is done in large scale, so that we can get a more result and we can use the same sample. That's actually main benefit of.
I'm sorry, Linda, can you repeat the question?
The question was, could you elaborate on the targeted market? Next question, who are the main competitors in the marketplace?
So the main competitors would be Thermo Fisher. Another would be then
Are you finished? I don't want to step on your toes. Okay. Have you done pricing analysis versus competitor products and ROI?
We have not done.
Thank you. We still have 9.5 minutes remaining in this session, so judges, please continue with your questions. What are the biggest expenses associated with your plan?
I think biggest is yes.
Anuksha, you can continue. You can continue. You can.
I think the biggest expenses associated with our plan would be to collaborate with research institutions, because we need to have resources, different resources in different laboratories. We need to have technical expertise, which is very in the initial phase of inception. To get technical expertise, technical know-how, people and other resources as well would be a very hard task. So I think to manage resources, it would be very expensive for us in financial plan. Siddharth, you can continue now.
Thank you. How are you going to fund your activities? Did you hear the?
Linda, I think there is some problem with at Siddharth's end. I don't know, something has happened. I think he has freezed or something, I guess. He's not able to respond.
Okay.
That's why he's left. I just want you to wait for 2 minutes. He'll be joining back.
Okay. I'll wait for him to come back on. Okay, there we go. We've got him. Okay, go ahead. Siddharth, did you have an answer to the question? Is that what we were waiting for?
Didn't heard the question.
Okay. How are you going to fund your activities?
I think we will be talking this initially for expanding in some countries. Then gradually we will use more fund B series and C series funding. Continue further in expanding our operations.
Thank you. Would you reach out to pharmaceutical companies, and if so, how?
Reach out the pharmaceutical, mail them the and the benefits of it. From the team can go and explain them what the benefits they will get and how can it reduces their cost.
To what Aniket said, we be sharing if like any milestones we accomplish or any task and success we get, that would add to brand and reputation of our company and startup, and then that also we would be sharing in the mail with the company, so that they get to know how popular and how fast we have succeeded and what accomplishments we have made.
Thank you. Could you speak to the timeline for this scale-up plan? How quickly would you expect to see growth related to this plan?
Growth will be slow in this case, as it is a costly machine and will not be able to purchase it at a go. So we have some big companies, research labs will purchase this machine, and when that's all. Thank you. The timeline would be actually around 4 months.
Thank you. We still have 5 minutes remaining in this session. Are there any other questions? Once you've established early customers, how would you expand?
She is not able to hear half of the things. She's losing in, I think the voice is echoing or something like that. She is told. Like she's asking us the question. There's some kind of disconnectivity here. So I request you to give kindly give us 2 minutes that she can join back.
Exit and return to the session. When we return, we'll have 3.5 minutes remaining. Ayushi, can you hear me?
Yeah, now I can hear you.
Okay, I can hear you. We have about 3.5 minutes remaining in the session. Go ahead. Once you've established early customers, how would you expand?
So once we establish early customers, to expand, we would like to know what their specific requirements is, like what the sample they deal with, what are the exact objectives they are working with, so that we can customize the instrument according to their needs, the sample size, the size of the instrument, as in the volume. Based on that, customization can be done. So that's the plan that we have thought of.
Thank you. What are your thoughts on the pricing model? Are there any avenues for recurring revenue?
Revenue will basically be based on the product price, product of the price, and the services we offer after sales services. So we will initially ascertain what the cost is incurred on making the product, and then we'll add some. We will put our margin, and then we will initiate the plan. That's how our revenue model will work. Thank you.
Thank you. What is the biggest risk associated with this plan, and how would you try to mitigate it? We have about 2 minutes remaining in the.
One of the risks could also be like the customers that are currently using flow cytometer would not like to change their instrument as they have invested a large amount of money on that. So one of the risks would be to mitigate that. We have to develop a mitigation strategy, like what advantages we have in our products that would urge them to switch their instrument.
Thank you. We have about 1 minute remaining.
And then other than that, what Ayushi said, I would like to add in early phase, the conception phase, there would be, since the expenses and the investment is very large, there would not be that kind of profit also. So we have to, in inception phase, we have to deal with low profits and but high amount of investment. So we have to keep sailing in and develop brand loyalty amongst the customers, so that they shift to our cytometer rather than the instrument they are using. It is associated with this phase is associated with low profits and more kind of initial investment.
Okay, this session is over. I would like to thank this team again, coming all the way from India. I'm sorry we had some technical issues, but we got everything out there that we needed to do. I'd like to thank the judges for participating. I'll give you a couple of minutes before the next session begins. And again, thank you again for joining us. And it was a very nice presentation. Thank you so much.
So good afternoon, everyone. We are from Rowan University in Glassboro, New Jersey, USA. And our case here is scaling BennuBio. And what they do is they have this machine that is really state of the art. It has a base price of $100,000. So that's for that unit that you see on your screen there. They have gotten the patented algorithms, and it is a more capable product in late 2021. So they're still working on it. It's not like it is patented and this machine is theirs, but it is still like little tweaks here and there. But of course, they have leaders who know what they're talking about, and they have a lot of experience in the biomedical field there. And of course, the diversity is a huge part in their day-to-day and in the staff members as well. So here we have our approach is really just to scale this company from where it's at to being on the market, to be readily available, and to have the machine there go and be more accessible. Because right now, like I said previously, it's still in the not early stages, but there are still plenty of tweaks to be done and plenty of improvements that can be made, which is why we've been brought in today. So we have come up with 5 recommendations off of these of this survey that we've conducted. The survey was a little bit less than 50 people were asked to come up with ideas there. So we have come up with different like funding ideas, different analysis, ways to analyze the cells and different stuff like that. So we thought that these ideas would require the initial investment of under $5 million and to yield at least 1,000% of the ROI. So this is a quote by Linus Pauling. I don't know if any of you have heard of him, but fun fact about him is that he has won 2 Nobel Peace Prizes, and he is the only person to have received 2 unshared, so nobody else was involved. It was all his doing. And the quote states, "The best way to have a good idea is to have a lot of ideas." And this quote, to me, says that just because one idea doesn't work doesn't mean that you should just stop and give up. You know, like write down the ideas, have multiple ideas, have different variations of the idea. And just because one isn't working necessarily doesn't mean that all your ideas are bad or that they won't work. So here we have our approach and allocation of ideas. Like I said before, we brainstormed 50 ideas, approximately 50 ideas from under 50 people. And there are different layers to it. So some ideas kind of coincide with other ones, and you'll see from our first scaling recommendation coming up that all the other ideas can trickle down from that. So we wanted to get the best ones though. So we wanted to have product application extensions, market expansion, intellectual property, partners, and scale enablers. So what does that look like for the payoff here? Well, as you can see from our lovely chart here, we have near term, which is going to be under 2 years in the top left. And then the ideal state would be to be in the top right corner there, where it's relatively near term, but we have a good amount of revenue and profit growth there. But the long term there, you want things to be done as quickly as possible and as profitable as possible. So our first recommendation here is to use the machine for COVID-19 and other viruses, to be able to analyze them and to detect these viruses in an earlier state than when we find them now. Because the CDC has said that we were not ready for H1N1, and really the world wasn't ready for that because we couldn't analyze the data, just we were not prepared. So then when COVID-19 has hit, we definitely weren't prepared, and it was on a much bigger scale. Here we find that more testing, and with this machine, we would be able to analyze more cells and more data efficiently. We would have been able to gotten on top of this virus here and potentially scoped out earlier than we did. But of course, the main thing is to engage in public health agencies, so to partner with them. Like I said, the CDC could be involved, other expenditures as well. So we have come up with this analysis here, which it is all assumptions here. So the numbers can be skewed a little bit, but for the most part, we think these are fairly accurate. So if we assume that 1% on testing alone is about $30 billion, we can assume that 10% of that is spent annually on $3 billion in the future years. So as you can see, it would be good for the long term, and it would be profitable. But again, we want things to be near term and profitable as well. So pass it on to one of my colleagues here to do the next scaling recommendation.
So for our next recommendation, we are suggesting that they bring the drug discovery application and take it to the biofuels market. And here we are saying they can partner with major companies like BP, Exxon, Valera, all those gas and oil companies to mandate the transportation for fuels. And we think that these firms we're assuming they'll buy each 10 of the machines. And our assumptions coming from the fact that they've already spent over $250 million in research on such things like this, so they will be willing to also allocate funds to these machines. So we're assuming the cost to develop is the $100K, and that they will be willing to do this for the biofuels. Sorry.
For the next scaling recommendation, it's the same category as Brady had mentioned. And our concept idea was for cellular and DNA profiling and analysis, just for multiple things such as commercial, government, and consumer applications. And that'll include the oncology diagnostics and histopathology. And then the DNA profiling aids will help us better understand this predisposition of the diseases that are out there now, such as COVID-19. Strategic actions for this would be to sell the data to pathology analysis firms, such as Proscia, CDX Diagnostics, and more. And for our analysis, we estimated that the total global market size for many types of this is around 7 billion. So if we have 3 million to develop the application, or we would need 3 million to develop the application capability, and that would be funded through the equity round. And for the payoff estimate, this would of course be near term. But if we were to capture 1% of global market yields with the revenues of 70 million, our return on investment would be around 2,300%. For the fourth recommendation, again, the same category. Our concept idea for this one was just to extend the application space, including detection of genetic disorders, and provide analysis services to genomics and screening forms. And a genetic disorder, which of course is disease that is caused by a whole or part in the change of the DNA sequence away from the normal sequence. We can analyze that. And we just want to conduct product market fit analysis for the genetics market. And you can find, including personal to direct genomics firms, which everybody is probably familiar with 23andMe. This market is valued at around 20 billion. And if we were to capture 1% of the market, it would be 20 million with a 2,000% payoff investment. And this would, of course, be huge, and the only downside is it would be long term.
So for our fifth recommendation, we would like to include forensic imaging functions such as virtual autopsy to extend the application space. With the rationale, this would increase the preference for virtual autopsy in different procedures and faith groups demonstrated in the NIH VirtoBot project. We suggest to partner with Virtopsy to supplement the solution and also provide organoid analysis. There would be 1,590 medical examiner offices in the USA. And the good part about this is that there would be no new funding required. We would use the existing analysis capabilities. So to assume the ability to sell alongside Virtopsy, 10% of the medical examiner market would equal 150 units, and that would be at $100,000 unit, which would equal a $15 million revenue. With that last recommendation, I will pass it off to Brady to finish this.
All right, thank you very much, guys. So, of course, these are some other ideas that we have also considered as well. Like I said, we have the government contracts there with the CDC, you know, the WHO, everybody like that. But we can also improve the way that the website is. How, I mean, you see the video right away when you go there, which is great and all. I found it very informative. But we can really focus on the application and what this company brings to the table. You know, like we have that it can analyze cells at 10 times the speed, which is great. I mean, that's like should be the biggest focus here because that, I mean, that's exponential growth there. We'd also like to donate or sell or lend a small number of units to U.S. medical schools, you know, like that would help with our partnership with CDC, and it would help with the biomedical technology that we're really trying to analyze the cells here. But other ideas kind of branching off of what we've stated previously there is that we could be able to analyze the cells of different animals as well. So this is not like lab rat testing. It's not like that at all. It would be all voluntary. You could like send in with your pet's blood sample, and then you can see, okay, because of this, the rate that we have the analyzing here, you could see if it was like a cancerous thing there, or you could also send it, I mean, humans can do it as well. And what that would do is it would cut out the middleman there. So you would go from the company, BennuBio, having the machines there, and the individuals would not have to go through like a doctor to see that. They could get the sample back and it's untouched, like it said there, but that would be another idea there. So we have the core technology here. Like I said, our 5 ideas there, we need the investment of 6.1 million. The ideas, 265 million with a 4,300 net ROI. We create multiple firms that have their own exit at different times. So we'd like to thank you from the Rowan University team here, the College of Business, the College of Engineering, and the College of Math and Science. So thank you very much.
Okay, we have 7 minutes remaining. If the judges would please ask their questions in the Q&A tab. And again, judges, this is the Rowan Group 2 for your judging. Which of these ideas would you prioritize and why?
So we would prioritize, really, I think the first one, which is why we put it first, because I mean, we've all been impacted by this COVID-19, and I feel like if we had discovered this earlier and had more testing and quicker testing, that way we would be able to, again, discover faster and be able to react to it a lot quicker than we did the response here now.
Thank you. What staffing changes, if any, would be needed to implement these recommendations?
Give us one moment to discuss that. The staff changes really would just be something to get the organization be able to produce it at a faster rate. So I guess more, not an assembly line necessarily, but just something that would give us the ability to produce these at a much quicker rate and be able to market it a little bit better. So I guess more marketers and more engineers.
Thank you. Your ideas focus on US market. Would you also reach out internationally?
Yes, I think with the WHO, we could do something there with the World Health Organization. I believe that's something we could do, global partner, but for right now it is USA.
I know too, for at least the fourth recommendation, we even have it assumed for the global market as well. So I know that it was a plan. At least it's probably easier just to stay with the US and then reach out globally, but it was measured through the global market as well.
Thank you. Can you describe potential recurring revenue sources?
Yes, so I believe, like I stated earlier, with the testing of either, like, you can have your pet sample or your sample, you could be able to analyze that and have them repeated over so they know like what it is that they have being analyzed, so they could keep coming back and keep going back. Or bigger organizations as well, they could do that and partner with them too, so that'd be a repeat customer.
Thank you. We have about 3.5 minutes remaining. Judges, please continue to ask your questions. How did you estimate your funding requirements? Where would you get the money from?
So we assumed the numbers right away, but the funding, I believe, I'm just going to talk real quick with the funding here. I'm just going to talk to my team.
I did want to mention one thing too about recurring revenue sources. There could also be maintenance supports for the units that are sold, because if people are having problems and they have to have the maintenance, or they just have to have them checked, we can charge for that as well, or they can have that charged as well. And then
go ahead, Jacob.
There were, I'm just trying.
So the estimates that we came up with came from Rowan Models, actually. So at the engineering lab, we've come up with them there. So it would come from equity rounds and internal cash flows as well.
Thank you. What do you see as biggest risks, and how would you mitigate?
All right, so we're going to need 1 minute to think about the risks here. Maybe not 1 minute, but.
2 minutes remaining in the set.
Okay. Just the acceptance, if there's market acceptance, that would probably come up as a risk, or if it fits into the product market as well.
So the customers would have to be on board with it to, pay the price for the machine or be comfortable with the technology and all that. And so that's how we would build this trust with the customer, really.
Thank you. Can you speak about your research and survey strategies to develop these recommendations?
Yeah, so we have researched through many different ways here, and we've done many studies that show that this market really is it's expanding a lot, and from this COVID-19 we've all kind of been affected. So really from the team here, they can all speak that we've all seen it work, and we all would like to see quicker results for testing and different stuff like that. They'd like to branch off of them.
Yeah, we used like internal team brainstorming as well between us and between our professor, and then a lot of the data was based on data from Boston Analytics, and that was provided to us as well.
There was about 25 seconds remaining in this session. Are there any other questions? Okay, I would like to thank the Rowan Group 2 for their presentation. Thank you so much for joining us. We hope that this has been a good experience for you. And